Hello guys, so in this video, I'm going to be telling you why I choose to go to work looking like a dermatology ghostbuster. So for those of you who don't know me, I'm Dr. Whitney Bowe. I'm a board certified dermatologist and I have a passion for all things skin. I contribute regularly to Good Morning America. I'm also the only dermatologist on Credo's Clean Beauty Council. And I'm known for taking a holistic yet evidence-based approach to the skin. Why do I choose to look like a dermatology ghostbuster every day when I go to work? Why did I choose a PAPR over an N95? That's what this video is about. The reason that I'm making this video is because when I started going back to work, wearing the PAPR, I didn't realize until I started talking to my patients just how many other people out there didn't even know that this option existed. And, whether I was talking to people who practice medicine, they're in the healthcare profession, or they have a relative who's, a dentist or a dental hygienist, or I actually even had some patients come in who are makeup artists or facialists, estheticians, who said to me, "Oh my gosh, Dr. Bowe, what are you wearing? Because I've been nervous to go back to work because as part of my job, I need to remove the mask of the person that I'm treating, of my client. And I'm not comfortable wearing the N95. What are you wearing? How does this work?" And that's when I realized nobody is out there really talking about PAPRs and what the differences are between PAPRs and N95. So this video is to just inform. I'm not, I'm not passing judgment on anybody's decision, right? This is such a new space for everyone. There's no right, there's no wrong. I'm going to tell you about my journey. I'm going to tell you about why I chose to use the PAPR over the N95, and then I'm going to finish the video by just clearly talking through what I see as the pros and cons of each. So first, to give you guys a little background on myself and my practice. So I am a cosmetic dermatologist. I'm primarily procedural. So I spend my days injecting fillers like Bellatero, Juvederm, Restylane, Sculptra. I do microneedling procedures, vampire facials. I do lasers like Fraxel, V-beam, etc. So most of my day is spent treating a patient who's not wearing a mask, and I am up close and personal. So I'm really in that patient's space, and oftentimes that patient is breathing into my face. Because remember, what I'm doing hurts a little bit, just a touch. So they're oftentimes having deep breaths. They're using their breathing to control their discomfort. And of course, they're breathing in my face. For cosmetic dermatologists who do a lot of injectables, that there are certain trigger points or tickle points, that you inject and the patient will sneeze. So that's also a potential hazard. That's just part of my job. So as you can imagine, when COVID hit, I went back to work immediately wearing what everybody else was wearing. I put on the N95. This is a typical N95. This is the type that I actually started wearing when I went right back to work. The way that the N95 works is it works by creating a tight seal. You have to be fitted in order to have a tight seal because this is a respirator and the filter is built into the mask. So when you're wearing this and there's the seal that's created around your nose and mouth, when you inhale, you are basically sucking air from the surrounding room. It's being filtered directly through the mask, and that's what you're inhaling. So if the seal is compromised in any way, if this is not tightly fitting, if you have any facial hair, then your filter is compromised, okay? So I was wearing this to start, and I can tell you I wasn't happy. So I'm gonna give you a very honest account of my personal experience with the N95. So my first day back, I was actually on the Upper East Side, New York City. I have two offices, one there and one in Westchester. And I was wearing my N95 with my tight seal, and I was communicating with patients. I do a lot of counseling in my office, and I found myself getting lightheaded. I found myself getting dizzy. I felt like I wasn't getting enough oxygen. I found myself taking breaks. I found myself curtailing what I was saying to patients because I desperately wanted to get out of the room and pull off my mask and reoxygenate and take a deep breath. After a few days of wearing the N95, I found myself developing a fatigue at night, I was getting really tired. It was like a Mack truck hit me. It's almost like I had the flu. I actually worried that I was developing COVID. I was like, why am I so tired? Why am I so tired? Really, when I would recover over the weekends without the N95 and get back my oxygen levels, I felt perfectly fine. So I realized that this was a problem for me. I think that some people are much more sensitive to the sensation of not getting as much oxygen. You know, with the N95s, you get about 5 to 20% less oxygen as you would without an N95. I think for some people, that's not a problem. And if you don't have any underlying medical conditions, you know, it shouldn't be a problem. But I think that there's a couple of different factors at play. Number one, some people are just more conditioned to having slightly less oxygen. I also think there's just different people have different sensitivities, right? Like some people are always cold, some people are always hot, some people can tolerate changes in temperature more readily. You know, some people are more comfortable with not feeling like they're getting as much air as compared to other people. Another problem that I personally had with this mask was that I'm very expressive. One of my favorite things about my practice is I have this very intimate connection with my patients who are coming to me. They're oftentimes, you know, very vulnerable. They're talking about their insecurities, things that they don't like about the way that they look. And they're a little bit nervous, right? Because some of the procedures that I do, you know, involve needles, involves blood, you know, so patients are a little bit nervous. I genuinely really care about having that connection with my patients and putting them at ease. And I found that not being able to use this part of my face to do that, I found that it compromised the way that I like to practice medicine. Okay, so I absolutely love my job and I absolutely hated wearing an N95. So I went home and I did what I do best. I thought outside the box and I did research and I found the PAPR. So I'm gonna walk you through the PAPR, which is what I wear to work. Again, this is my personal decision. This is something that I'm comfortable with. And if this is an option that is something that you're looking for, that's great. But if you don't choose to use this, again, this is just another option. And this video is just meant to inform in case you happen to be struggling, you or a friend or family member, a relative, somebody that you care about is struggling with the N95 and is looking for an alternative option. Here it is, my PAPR. So first, this is my battery pack that I wear around my waist. So what I do is I strap this to my back and I buckle it in the front. And in here, there's a little pre-filter right here, and there's a little major called a HEPA filter inside here. So what this does is it sucks in air from the room. It goes through the filter, and the filter filters out. So you have an N95 filters 95% of particles, small particles, including infectious pathogens such as viruses and bacteria. Okay, so this filter filters, when you're using a PAPR, it filters between 96 and 99.9% of those small particles. Okay, so it's pulling the air, it's going through the filter, and then that filtered air comes up through this tube, and that tube goes into the back of my hood, and there's my hood, and then all day long, I have cool filtered air blowing like a little fan, like a little self-contained air conditioning unit onto my face. And it's generating positive pressure, okay? So in the hood, there's positive pressure. Outside of the hood in my environment, there's lower pressure. So because of that pressure differential, it doesn't require a seal. So whereas with the N95, which I dropped somewhere, but you guys know it creates that seal and it requires that seal and you're breathing through the filter. With this one, you're not breathing through the filter. The air is going through the filter, it's going through the hose, that filtered air is blowing down onto your face, and that differential in pressure is what's stopping the air from the room, the unfiltered air from the room, from coming back up into the hood. It's cool, the sensation is nice. The other thing that I love about this is that my patients can see my full face. So they can see me smile, they can, just see all of my emotions. And so for me, I value that connection. So, I, again, as I explained before, I'm a dermatologist, I'm a cosmetic dermatologist, I have my patients remove their masks. So in the room, when it's just the two of us, my patients have their masks off, they're able to see my entire face, and we have that doctor-patient connection and relationship and rapport that I think that patients crave, that I certainly crave, and that I find to be so meaningful and so beneficial to our ability to, really make good decisions together. So I'm going to try to do a quick pros, cons comparison between the N95 and the PAPR. One does create, it relies on that tight seal, right? So that decreases the breathability, the comfort. For me, that was a really big deal. For other people, it may not be as big a deal. It also, that seal is actually putting pressure on the skin. So you may have heard me talk about mask knee on Good Morning America, on Dr. Oz, in different news publications. Mask knee is a real thing. Like, people are breaking out because of the friction of masks, whether they're regular masks or N95s, against their skin. A lot of healthcare practitioners, especially when they're wearing these for long periods of time, can not only develop mask knee, but they can develop irritation. It can really impair the skin barrier because it's really putting a lot of friction, a lot of pressure against the skin. That is obviously not an issue with the hood. The other thing I said that I do love that the patients can see my full face on this one. I love that it has cool air blowing on my face. Just that comfort for me was critical. Being able to have that patient connection where they can see my entire face, critical for me. Others between the two, so this one you can wear if you have facial hair. If you have the N95 and you have facial hair, that's gonna compromise the seal. It's gonna become a problem. I made this video because I know that there are people out there, whether they are in healthcare, doing some kind of a procedure that involves removing somebody else's mask, or maybe they're just a teacher afraid to go back to school in the fall, and they're looking for options other than, a mask that protects them. A regular cloth mask doesn't protect you, right? It protects the people around you. But I know that there are some of us who are very scared, and there's a lot of anxiety, and you're looking to also protect yourself. And that's when you have to start thinking about respirators. So choosing between an N95 and a PAPR, the whole purpose of this video was to give you a choice.